Welcome, 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 everybody. We are so excited to have you here tonight for the Raleigh North Christian Center presentation from our Healthy Lifestyles Ministry of Heart Disease Prevention. February is Heart Disease Prevention Month and Love Month, so we're really excited to share this with you. My name is Rita Brewer. I have had the awesome honor and privilege of serving as the Healthy Lifestyles Ministry leader at our amazing church, Raleigh North Christian Center, in our beautiful city of Raleigh, North Carolina, for the past 7 years. And we are really excited to bring you this presentation tonight. We first, of course, want to honor God, who is our all in all, our everything. We want to honor our pastor and first lady, Dr. Jeffrey Chapman Sr. and Lady Sandy Chapman. We're so grateful for all of they do for us. They are so passionate about supporting us in every area of our lives to help us prosper. And we have over 40 plus ministries at Raleigh North Christian Center. So they build us up in every way possible. But of course, I'm most passionate about our Healthy Lifestyles Ministry, as I've been a physician assistant for over 30 plus years. So I'm really excited for this presentation tonight because if you don't know already, heart disease is the #1 cause of death in America and has been for a very long time, which is really sad because, you know, with all of the advances in technology that we have around the world, we're still falling behind. And then heart disease rates are still really, really high and the #1 cause of death. So that's why we wanted to share this presentation with you tonight. And, you know, we're not doing a great job in our healthcare community because these people are still dying of this. So we are taking it to the streets, we're taking it to the airways, we're taking it to the World Wide Web to get this message out to as many millions of people as we can around the world, whether it's tonight live or sharing it on the replays. So we're really excited about it. I'm excited about my passionate team that you're going to get to meet tonight, who are also who are going to be presenters and moderators tonight, and our social media team that you'll be meeting in just a moment. And also, this event is going to be interactive. We're going to do a presentation first, but we are going to have a live Q&A at the end. So whether you're whatever platform you're streaming from, we will be able to receive your comments and questions. So please share it, send us hearts, send us comments. Let us know what stands out to you. What are you learning from it? What are you excited about? Maybe you learned something new for the first time. Share it with your friends and family because the more people that gets this message out, the better. We'll answer your questions at the end of the presentation, but please feel free to put them in the comments now. We'll keep a running tally of those, and we're going to answer as many of those as we can at the end of the presentation. And if we don't get to all of them tonight, we will answer them later after the broadcast is over. So I'm really excited. So without further ado, I want to introduce you to my co-moderator tonight, the awesome, beautiful Miss Patrice McRaven, who brings the joy and the sunshine wherever she goes. So Patrice, welcome. I'm so glad that you're my co-mod tonight, and welcome to the team.
First off, thank you so much, Rita, for just that wonderful, warm welcome. I want to say great day, great blessed day, great blessed night, great blessed evening, afternoon, depending on when you see this stream, because we hope and pray that this stream goes for years and years and it touches many homes around the world. I am Patrice McRaven. I am a part of the Healthy Lifestyle Ministry, and I'm so grateful to be the co-moderator tonight. I am an Air Force veteran. I'm a mom of 2, and I have a passion for the healthy heart. And so when I was asked to be a part of this, I was like, yes, it is Love Month, and the best time to talk about getting that heart preventative maintenance in, that wellness check for you, the second month of the year of 2024. Why not now? We are going to have an awesome, like Rita said, group of people that are going to talk to you, professionals. But we are not in a professional environment. So we want you to share this. We want you to we want you to comment. We want the questions. And even if we can't get to it during this session, make sure you follow us on our social media because we are going to answer the questions that are being asked. This is completely interactive, and we are going to get out of the way because we have some phenomenal people that are going to talk to us. And the first person I want to tell you about is absolutely amazing. But First and foremost, what I want to do is I want to open us up in prayer. So,
Amen.
Father God, we come to you in the mighty name of Jesus and we give you thanks. We give you thanks for the breath in our body. We give you thanks that we have technology that allows us connect around the world. We thank you for Raleigh North Christian Center and the heart and the passion of our pastor and our lady Chapman, who had a vision for health is wealth. 23 years ago, 24 years ago. And here we are doing the kingdom work. God, I thank you for every single presenter that's going to come and bring information, whether it's new to the people's ears for the first time or it's a reminder to remind them the body needs the heart and the heart needs the body. God, we thank you for everything you're doing in our life. We give you all the glory, honor, and praise in Jesus' name. Amen. I am so excited,
Amen.
you guys, for this wonderful woman. Thank you, Rita. Miss Tasha Terry's, you guys, God has blessed Tasha to live out her childhood dream since age 11 of becoming a master prepared registered nurse. Tasha has practiced nursing for 29 years with 3 classes left to complete her doctoral degree in nursing practice. So soon enough, we're going to be saying Dr. Tasha very soon. She has been blessed to work in many different areas of nursing. She has worked as an academic nursing instructor at Wake Tech Community College and as a clinical nurse educator for you guys, units within the at UNC healthcare system. Currently, Tasha works as an assistant nurse manager on a cardiac procedural unit. Tasha loves focusing on health and sharing her knowledge with others. And that is why she is the first person opening the door, kicking it in, and sharing about Heart Disease Awareness Month. Tasha, are you there? The floor is yours.
Hi, everybody. And
Yes,
I would like to
girl.
thank Ms. Rita for leading us.
Well,
I'd like to thank Patricia
welcome.
for that wonderful introduction. And I would also like to thank our First Lady and our pastor. So,
Amen.
my name is Tasha, she said, and I'm going to start out with a scripture and then I'm going to get right into it so we'll have enough time for everyone to present. And I'm excited about this because this is my topic. This is what I do. And I really believe I was born to do this. So let's get into some scriptures. 1 Corinthians 6:19 and 20. I'm going to read the King James Version. Verse 19, it says, "Don't you realize that your body is the temple of the Holy Spirit who lives in you and was given to you by God?" Ain't that a blessing? Verse 20, "For ye are bought with a price. Therefore, glorify God in your body and in your spirit, which are God's." So I'm going to go right into it, you guys. So, the agenda. Tonight, we're going to be talking about what is heart disease. We're going to do an intro to the 4 categories of cardiovascular disease. Now, before we get started, I will say that sometimes medical terms are very complicated. So, our team has tried to simplify it as much as possible. So, we do use abbreviations a lot to cut back on the long words. I'm sorry. So, the 4 categories are coronary artery disease, CAD, cerebral vascular disease, CVA, also known as stroke, peripheral artery disease, PAD, aortic atherosclerosis, heart disease statistics, we'll talk about that, signs and symptoms of heart attack and stroke, the risk factors, signs and symptoms of peripheral artery disease or PAD. We're going to talk about what causes arterial damage, the abdominal aortic aneurysm, and a case study. So we're also going to get into the preventative methods and ways to reduce heart disease. Now, don't even worry about all these long terms. We got our panel that's going to explain everything to you, and you'll be walking away with some new knowledge, and you'll be able to understand it. So we're going to move forward. The learning objectives. The audience will gain knowledge and information on the cardiovascular heart disease, signs and symptoms, and risk factors, and the preventative methods. Heart disease statistics. Now, when we get into statistics, statistics can be very, very, very alarming, but at the same time, overwhelming. So, what I'm going to do is I'm going to give you some stats, but I'm really going to focus on what is prevalent to us in our population. So, heart disease remains the number one cause of death in the United States, according to 2020 data. Now, one thing about statistics, over a lifespan, it takes a long time to collect the data. So, a lot of times, even though the statistics are current in 2024, it may be the data from 2020, which is only 4 years later. So, cardiovascular disease, which we also call CVD, is listed as the underlying cause of death, accounted for 928,741 deaths in the United States and America as of 2020. And I've been in practice for 29 years, as Patricia said, and it has always been the number one cause of death. So we do know that in 2017 to 2020, in the United States, 59% of non-Hispanic Black females and 58.9% of Black males had some form of cardiovascular disease. So Black Americans had the highest prevalence of cardiovascular disease. And the other statistics is just telling a whole bunch of numbers stating that stroke and cardiovascular disease is the highest cause of mortality, which means death in the US. So now we're going to talk about the diseases, those four categories. Coronary artery disease, and we can also call it CAD. It's caused by plaque buildup in the walls of the arteries that supply blood to the heart and other parts of the body. That picture shows it, but one of our panelists is going to give you straight detailed facts on that. CAD is manifested by myocardial infarction, which is a heart attack, in which the coronary arteries become blocked, which leads to ischemia or lack of oxygen supply to the heart. It's also caused by angina pectoris, which is chest pain, heart failure, and coronary death, which is a cardiac arrest. What is cerebral vascular disease? It's also called a stroke. There's two types. One is ischemic, and the other one is hemorrhagic. So let's talk about the ischemic one first. Most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked. Blocked or narrowed blood vessels are caused by fatty deposits that build up in the blood vessels or by blood clots or other debris that travel through the bloodstream and lodge in the blood vessels in the brain. And that picture there, it shows it. Now we have our other type, which is hemorrhagic, also known as a bleeding stroke. It occurs when the blood vessels in the brain leaks or ruptures. Brain hemorrhagic can result from conditions that affect the blood vessels. Factors related to hemorrhagic stroke include uncontrollable high blood pressure, also known as hypertension, overtreatment with blood thinners, anticoagulants, bulges at weak spots in your blood vessels, and trauma, such as a car accident. Peripheral artery disease also can be called PAD. There's a picture there, and one of our great team members are going to go into great detail on that. You're going to love it. Peripheral artery disease is a narrowing of the peripheral arteries that carry blood away from the heart to the other parts of the body. It's manifested by intermittent claudication. They're going to explain all of that to you later on. The most common type is lower extremity PAD, in which blood flow is reduced to the legs and feet. Upper extremity PAD, which is arms, hands, and fingers, is less common, but affects about 10% of the population. Aortic atherosclerosis, that's a big word, ain't it? It's a condition where the arteries become narrowed and hardened due to buildup of plaque, which is fats in the artery of the walls. There's two types, thoracic or abdominal. Thoracic aneurysm is a weakened area in the upper part of the aorta, the major blood vessel that feeds blood to the body. Aneurysms can develop anywhere in the aorta. The other one is abdominal. An abdominal aortic aneurysm is an enlarged area in the lower part of the body's main artery called the aorta. The aorta runs from the heart through the center of the chest and belly area called the abdomen. Here are some additional thoughts about everything that we talked about. Uncontrolled hypertension or high blood pressure affects the arteries, which can lead to kidney disease, heart attack, heart failure, vision loss, sexual dysfunction, and stroke. When it comes to uncontrolled hypertension, high blood pressure is the silent killer. So that means sometimes people can go years without their blood pressure being checked or out of control, and which results it wears on those arteries and it can cause kidney disease, a heart attack, and vision loss because all of those arteries are related. Then we have cholesterol. It's made by the liver and it's important in cellular function. That's the healthy part of it. The hormone balance is responsible for hormone balance, vitamin D production, and biodigestion. It is essential and we can't live without it, but we need it to be a healthy level. And the last thing I'm going to mention is elevated blood glucose. I'm sorry. It's associated with atherosclerotic CAD. So it is caused by inflammation in the body, which damages blood vessels. Diabetes account for 10% of the population who are at risk for heart attack. And that is my thoughts. And I am so grateful to be able to present. And I am going to pass it back to Miss Rita.
Thank you so much, Tasha. That was awesome. And I'm excited to lead into our next presenter. Please welcome Dr. Frida Sanders. She is a graduate of Tuskegee University in Alabama with a Bachelor of Science degree in Plant and Soil Science and Horticulture, and later with a Master of Science in Plant and Soil Sciences with a focus on plant genomics. Frida has years of diverse laboratory science experience, and she earned a PhD in public safety and emergency management. She is a registered biosafety professional and OSHA outreach trainer. Frida is the Associate Director of Environmental Health and Safety at CREA Therapeutics in RTP, and also an adjunct biology instructor at Wake Tech College. She found her career in safety to be most rewarding as every day is a service to others and enjoys sharing information with the community. So please welcome Frida Sanders. Thanks for being here.
Thank you so much, Rita, and thank you
My
all for
pleasure.
being here. And we're just going to dive right into it. So, as you just heard, you heard about numerous conditions that could lead to heart attack, maybe cardiac arrest, and stroke. And I just want to lead out with Ezekiel 38:7. Get ready, prepare yourself. You and your company gathered around you. You will be their guard. So, as a safety professional, it's my responsibility to prepare employees for adverse events at work if someone's having a heart attack or cardiac arrest. But today, I'd like to encourage you to be that advocate for yourself and for your loved ones and your community. So, let's look at the common signs and symptoms of heart attack and stroke and know how to respond if any of these events were to occur. So, for common heart attack warning signs, most people will develop the hallmark symptom of pain or chest discomfort. They may say that they feel a tightness in the chest or some burning. For a moment, they may be kind of unable to move because that pain is so intense. They might be lightheaded. They may experience nausea. Some may actually vomit. So you can imagine that the person might write off these symptoms as some other illness because these are very common symptoms. And then they might have jaw or neck, some form of back pain, discomfort or pain in the arm or shoulder, and it may be on one side versus the other. And then shortness of breath is another hallmark symptom. So God made us male and female, so it's important to know what some of those differences are between us. Men and women will experience, like I said, those hallmark chest pain symptoms, but men might experience back pain that's more centralized, and then women might experience back pain that's in the upper region. Women also experience abdominal pain and indigestion, so they might write off those symptoms that they have heartburn. Both might experience shortness of breath. More women experience extreme fatigue. And then, as I mentioned previously, nausea, vomiting, those are very common symptoms in both. So if you think that someone is having a heart attack, first of all, stay calm. You want to stay calm for yourself so that you can react appropriately, but also to encourage the other person that's experiencing that event. And if you yourself are experiencing symptoms of heart attack, keep yourself calm so that you don't work yourself up into a panic. And once you discovered that you have some of those hallmark symptoms, you want to call and get emergency services on the way immediately. While you're waiting on emergency services, you would give the person aspirin. If it's yourself, you would give yourself aspirin and make sure that you're chewing it. You don't want any food or liquids going into the body at that point. Then you're going to observe them until medical services arrives and check to ensure that they're breathing. If the person is not breathing, then you're going to begin CPR. With CPR, you would give them 100 to 120 compressions, chest compressions per minute. And this is for adults. You want to make sure those compressions are going about 2 inches deep. And you can sing the song Staying Alive to keep yourself in rhythm. For stroke, we have some different symptoms to pay attention to, and you can remember the acronym FAST. So the F stands for face drooping. Usually that person will have some form of numbness, or they might have a droop on one side of the face. So you can look at them and you can notice that something is off. You can ask the person to smile and to see if that smile in both corners of the mouth is symmetrical. Arm weakness. They may tell you that one of their arms feels numb or something like that, or that their arm feels weak. If that is the case, you do not want to move them if they're experiencing any arm weakness or numbness. And then for speech, sometimes a person's speech might be a little bit different. They might not notice it. They may feel that they're speaking clearly, and you notice that their speech is off. Another hallmark symptom is when they're writing. If they're experiencing that arm weakness or numbness on one side of the body and they go to write something on a document, you might notice that their handwriting is completely different. If you notice any of these symptoms, it's time to call 911. So while you're waiting on 911, you want to stay calm. You want to talk to the person, reassure them, keep them calm. You don't want to give aspirin in this situation. So aspirin was for heart attack. For stroke, you're going to ensure that they're in a safe position, as comfortable as possible. But like I said before, if they're having any limb weakness or arm numbness, you don't want to move them. Make sure that they're breathing while you're observing them. You can jot down any notes of anything that you observe where maybe they didn't have face drooping at first, and then you're starting to notice that, or their speech is slurred. You're going to write all that down so that when 911 arrives, you can provide them those details. If you are to begin CPR on that person, like I said, remember 100 to 120 compressions per minute, and you want to go about 2 inches deep into the chest for a adult only. Make sure that they're on a flat surface. The person is lying in the bed. You want to lower them to a hard, flat surface so that you can ensure that you're getting the depth that you need on those chest compressions. Do not give them any food or liquid. And if the person has nausea and they vomit, then you want to turn them on their side because you don't want to induce any choking. Lastly, I'll leave you with 2 Timothy 1:7. God has not given us the spirit of fear, but of power, love, and of sound mind. So let's prepare and let's take action for ourselves and for our family and community. Thank you.
Thank you so much, Frida. That was awesome. I just want to add one other thing too, that, when she talked about calling 911, do not hesitate. Do not wait to call 911, because there are certain treatments that we call like clot busters, which are certain medications that could be administered intravenously in order to dissolve those clots to help reduce the damage of the heart attack or the stroke. But you have to get them in a very short window of time. So don't delay, don't question. If you're not sure of anything, just call right away. So, all right, awesome. Patrice, who do we have next?
Wow, that was absolutely phenomenal. And I remember when I used to work in the ER, I used to see patients coming in. And so timing was always critical and crucial. They would always
Yes.
ask, when did the symptoms start? When did you
Right.
notice it? When did you feel it? And so this information, getting it before a person gets to the hospital, right? We love our family, we love our friends, we love ourselves. And so this information is to help preventative opportunities so that you are educated and informed informed. And we are so grateful for every single person that is here tonight that is giving us information. But I'm going to keep it rolling. And I want to present to you all Dr. Jared Day, who graduated from Morehouse College and Duke University School of Medicine. And he's practiced as a vascular surgeon for over 10 years in the southeastern US. He immersed himself into health and wellness after being diagnosed with type 2 diabetes and found his true passion. Dr. Jared Day, he's an avid runner and he spends his time with his absolutely phenomenal and his children. So we are going to get out the way and we are going to pass it on to Dr. Day.
All right. Thank you, Patrice. I appreciate that. You got me
Welcome.
smiling over here. And I appreciate you, Rita. And thank you, everybody, for joining us today, this evening, taking the time out of your schedule to listen to us with this important topic. And I also want to give honor to our pastor and to our first lady for allowing us to share this with the community. And with that, I'm going to go ahead and get started. So the topics I'm discussing today are signs and symptoms of peripheral arterial disease, or PAD. Y'all heard that from Miss Latasha. She talked about that. What causes damage to your arteries? I'm going to talk about that. And this damage, which consistently leads to the #1 cause of death in the United States after all of these years. I'm going to talk about that. And I'm going to talk about why it is still the #1 cause of death. Okay. Next, I'm going to talk about what in the world is an abdominal aortic aneurysm. You kind of already know that already. Ms. Latasha talked about it. And also, I'll talk about a quick case study on a patient I saw many years ago with peripheral arterial disease. All right, so when you talk about artery disease, also called atherosclerosis, which literally means hardening of the arteries, there are a lot of causes, right? But there are 4 major causes, what we call the big 4. There's smoking, diabetes, high blood pressure, high cholesterol, okay? And take a look at this movie here, because when you hear artery disease or atherosclerosis, you think it's just hardening of the arteries. What's really going on is over time in the wall of the artery, you see how that plaque is starting to build up and it's starting to squish the blood. So the blood is having a hard time getting past it. That's what's happening. So as that plaque builds up, that lowers the blood supply to your extremities or wherever the artery is. And that's what's causing all of these diseases. All right. And just so you know, we're all talking about the same thing. Artery disease is the same, whether it's in a heart or going to an artery in your brain. We just call it something different. So this artery, if it's disease and it's in the heart, we call it heart disease or coronary artery disease. If this artery that's diseased and narrow is in your legs, we call it peripheral artery disease. Y'all get what I'm saying? So that's why we're talking about these 4 different arterial diseases. Is because it's all typical, is basically the same thing. All right. And the question that comes up a lot is whether or not genetics plays a big role in artery disease. I'm here to tell you that's not the case. Now, you may have heard this before. Genes may load the gun, but it's our bad health choices, our habits, which pull the trigger. Okay, we as in medical professionals, healthcare providers, we tend to focus too much on genes and not about lifestyle habits. Of course, there's genetic diseases that cause artery disease, but they're rare. Genes may predispose you to disease, but it's our habits that's causing disease. And what do I mean by habits? It's our bad eating choices and it's not running or walking regularly. Okay. I really need you to hear when I say that we inherit habits. Of course, we inherit genes, but we inherit habits. So if you grow up with a parent or somebody around you that smokes, you're more likely to smoke. But we don't sit there and say, you got a smoking gene. That's why you're smoking. Y'all understand? So we inherit habits and culture. And I'm not just talking about culture that's, it's in multiple levels. Culture in your family, culture in your neighborhood, even countries got culture, okay? And what I mean by that is the American culture. We all have a typical American diet, and that's what's leading to a lot of our diseases, not our genes, okay? Back in the day in college, I had some cousins or maybe 10, 15 years older than me that started coming down with these diseases. And I'm like, I'm not, I don't want that. So I started running. And then, when my boys found out, they were like, bro, I don't run unless like the cops are chasing me. If I listened to them, I would have stopped. But of course, I'm a hardhead. But that's just an example of what I mean by culture. All right. So atherosclerosis follows a predictable pattern. So what do I mean by that? So this artery disease that I just showed you, that little video, it tends to narrow the arteries in the heart first. that's typically because of, a couple of things, mainly because the arteries in your heart are smaller than some of the other major organs, all right? But the thing with the heart is that it's powerful. It is resilient. So most people start developing this artery disease in your heart, but you have no symptoms. So with time, that same disease that's narrowing the arteries in the heart, it starts narrowing the arteries in the neck, which leads to cerebral vascular disease or stroke, increased risk of stroke. It also affects the arteries in your legs, but your leg muscles are not as resilient as the heart. So even a little bit of disease in your legs, which we call peripheral arterial disease, it leads to symptoms. But the problem is that people tend to focus on the leg muscles and they forget, wait, if you have disease in your leg arteries, you probably have it in your heart. Y'all understand? So that is the reason why peripheral arterial disease is still called a silent killer. People with peripheral arterial disease in their leg arteries, they have heart disease, some type of heart disease, but the problem is that they don't have any symptoms of their heart, and then people just focus on their legs. So let me tell you that what kills people with peripheral arterial disease in their legs is not peripheral arterial disease. It's the silent heart disease. That's why PAD is called the silent killer. All right. So that means that if somebody has peripheral arterial disease, leg symptoms, you need to check your heart. And that's one of the 3 things I want you to get out of my presentation today. If you have peripheral arterial disease or disease in your legs, check your heart. So just a little bit more about peripheral arterial disease. It's a disease of the arteries going to your legs, which eventually limits the blood flow. So the symptoms of PAD, peripheral arterial disease, are from your leg muscles not getting enough blood. Your leg muscles are super sensitive to that. So what happens? You start getting basically Charlie horses, pain and cramps in your legs whenever you walk. It's super reproducible. Whenever you walk, you have pain in your calves or your thighs. It could just be on one leg or the other, but calf pain is the most common symptom. And that's what Ms. Latasha was saying earlier. Intermittent claudication, there's just a fancy word that means calf pain when you walk, every time you walk. All right. Then when you stop walking, the pain goes away. All right. That is the number one symptom of peripheral arterial disease, the main symptom. All right. And we call this the early stage of PAD. So as the disease gets worse, it starts affecting more arteries in your leg. And then people start developing this chronic severe foot or toe pain. The feet and toes start changing colors. They're getting black and blue. It's like somebody stepped on their foot. There's a severe amount of pain. And then as the disease progresses, you get ulcers in the feet that won't heal. And as you notice, I got a picture of Samuel L. there. It's because several years ago, he was diagnosed with peripheral arterial disease. And so, as we all know, sometimes we forget, the disease doesn't respect any, anybody can get it. All right. So he ended up changing his lifestyle. I think he went vegan for a while so that he wouldn't get a stent. So should you get tested for peripheral arterial disease? So PAD sometimes is asymptomatic as well. So you should get tested for PAD, disease of the arteries in your legs. If you're curious about it, or if you have leg pain, you should at least talk to your doctor if you fit in one of those 2 categories. But the people in this, the 3rd and 4th category, you should definitely get tested for peripheral arterial disease. So if you're number 1, if you're older than 70 years with no other diseases, or if you're between 50 to 69 with either a history of smoking or diabetes, you should definitely get checked for peripheral arterial disease. And the reason is because there was a study over 20 years ago, the partner study, that showed that people in these 2 categories, 1 out of 3 of them had peripheral arterial disease, but most of them had no symptoms. All right, so testing for PAD is easy. It's just really just checking blood pressure in your arms, blood pressure in your legs, looking at the numbers, and you come up with something called the ABI or ankle brachial index. That's something you don't even need to worry about. Your doctor does this in his office. Okay, so this is simply just putting a blood pressure cuff on your leg, blood pressure cuff on your arm, and then measuring, comparing the 2 numbers, and then that's it. So this is really, I kind of harped on this before, but this is super important. PAD is an indicator of systemic arterial disease. Now it could be kind of confusing because I said PAD affects the arteries in your legs. But it's really like in your car when the check engine light comes on. It means if you have PAD, you got to check your heart. You got to check your engine. Because if you got leg arteries disease, you probably already got heart artery disease. So so remember, if you have peripheral arterial disease, then you also must check your heart for heart disease. And to add on to that, you also check your neck artery. We have an artery here called the carotid artery. It's one of the major arteries that feeds blood to our brain. So if you get this artery disease and this artery here, it can cause a stroke. It puts you at a high risk of stroke. And some doctors, most doctors know this. Some doctors or some healthcare professionals don't. So this is why we're having this webinar, because we want to give you this information to remind your healthcare provider to check your heart if you have any of these issues, okay? And I got a picture there of Felicia Rashad, because I think it was around 2008. She was pushing for the same thing. If you have peripheral arterial disease, check your heart. It's because something happened in her family. I don't know the details, but she was leading a major campaign around 2008. All right, so just to recap, if you got peripheral arterial disease and you're getting calf pain, whenever you walk, check your heart and check your neck artery. All right, it's simply for your neck artery, just getting an ultrasound. All right. And so just an example of this, I just want to kind of bring this home. I pulled this large chunk of disease out of a patient's neck artery, the carotid artery here. It's a surgery called an endarterectomy. So this guy, he was a smoker, but he had no symptoms in his legs, but because he was older, he was like 60 something, but he was a smoker. So his healthcare provider being smart, checked for PAD with a blood pressure cuff, found that he had PAD. He had no leg symptoms. But because he had PAD, she checked the heart, checked the neck artery here, found out he had a 99% narrowing in his artery here. So he was basically a ticking time bomb, basically. He was so close to having a possibly fatal stroke, a major stroke, that if the healthcare provider didn't check his artery here, he could have stroked out. And I hope I'm not messing up anybody's dinner. I took the picture far away so you couldn't see too much. You may be asking, like, Dr. Gerard, like, why are you taking pictures of that? In my practice, I was all about helping people not have to come back and see me. And smoking, and if you have some other issues like diabetes, high blood pressure, smoking is like lighting your arteries on fire. I tell people that all the time. So I would take pictures to try to convince them, look, this is where I pulled out your artery, stop smoking. All right, but I hope we all get this. All right, so moving on. A quick word about abdominal aortic aneurysms, or AAA. So for some reason, when this artery disease starts affecting the big artery in your abdomen called the aorta, the artery tends to grow. And some people, the artery, it gets a little narrow from the plaque, but most people, it actually grows. It turns into a blood balloon. All right, it's a time bomb. All right, so this is very common in smokers. We're not really sure why this reaction happens. It's something to do with the enzymes and arterial wall getting activated, but we don't have to worry about that. So it's very common in smokers. Most of the time, this is asymptomatic. And when symptoms do happen, it is a surgical emergency. That means that the aneurysm has ruptured or is about to rupture. So that's a surgical emergency. So the whole point of us talking about this is to prevent that from ever happening, prevent ruptures from ever happening. So with an ultrasound, you can figure out whether or not you have an abdominal aortic aneurysm. So if the people who definitely should get an ultrasound are people who are smokers, people with a family history of AAA, all right? Also, the AHA and ACC, these are two guidelines recommended by them. If you're between 65 to 75, history of smoking ever, you should get tested for the AAA with an ultrasound. If you're older than 60, you have a family history of AAA, you should get tested with an ultrasound. And I got a picture. There's a lot of famous people that died from this, apparently. One of them was Albert Einstein. They tried fixing it, and he didn't make it. So this, like every other disease, affects everybody. All right. So we're going to change gears a little bit. I'm going to talk to you about a patient I saw probably like 7, 8 years ago. So of course, it's not a picture of him. Let's call him Mr. Barnes. So Mr. Barnes, his early 60s, he was referred to me from the wound center for a non-healing foot ulcer. So the wound center professionals, being smart, they checked his circulation because his foot ulcer wasn't healing, and they found out he has PAD. So the ulcer was present for about 6 months. He also has a history of diabetes, smoking, hypertension, 3 of the big 4. And unfortunately, they were poorly controlled. He wasn't going to his doctor. Sometimes he would take his medicine, sometimes not. So on exam, I cover this up. Don't want to mess y'all dinner up, but pretty, nice size ulcer in the bottom of his foot right there. So he had a foot wound on his right. So remember I said he has peripheral arterial disease, so leg artery disease. So what should we check next? I'm sure somebody's saying it. I hear you. Yes, the heart. So before doing anything on this gentleman, I sent him to a cardiologist. He got his heart checked. He ended up needing 2 stents in his heart for a couple of blocked arteries. And as you know, now heart doctors are going through your wrist, and they make it look pretty easy. But the point is checking your heart before doing anything else if you have peripheral arterial disease. All right, so after he recovered from that, I took him to a radiology suite. Sort of looks like this. That's not me, but it looked just like that. And confirmed that he had some blocked arteries, which I'll show you. Just so you know, he didn't have any artery disease in his neck. Now, some of y'all may be saying that as well. And so in the radiology area, I don't know if you can see my mouse, but you see so this is a picture of blood flow in the leg. So this dark fluid is blood flow, and it's supposed to go from the top of the leg to the bottom of the leg. But as you see here, it stops right there and then it picks back up. So this right here, from here to here, is a blocked artery, all right? And that's what we were there to fix. He also had some narrowed arteries above and below, but this was the worst one, so I just showed this picture, all right? So we fixed the other two, and I was able to get through this. That's the wire going through the blockage. There's something called the subminimal angioplasty, which, replaced the stent, and we got it looking good, got blood flow going back to his foot. Everybody's happy up in the angio suite. We dapping each other up. We stamping out disease. Everybody's happy, right? All done. Yay. But is that it? And that takes me to something I really want us all to remember. Peripheral arterial disease and arterial disease is a result of bad habits. This is the reason why heart disease is still the #1 killer. All right. And let me just focus first on peripheral arterial disease, but I'll talk about that specifically next. Only focusing on symptoms of arterial disease, like in the leg, is like focusing on water filling a sinking boat, but ignoring that there's a hole at the bottom. Unfortunately, our medical system, is what we got, but it tends to focus more on sick care, taking care of you when you're sick, but not about health care, as in preventing you from getting sick again or period. All right. For this, for Mr. Barnes, post-op, after he recovered from the stent, I spent most of my time talking to him about not coming back to see me. I wanted him to stop smoking, he needed to see his doctor regularly to get the diabetes and hypertension under control. And most important, which is, the underlying part of this whole slide, making lifestyle changes to get healed from diabetes and hypertension. The pills, the procedures, procedures are fun. I like doing it. But I don't want to have it. Why would I want you to have it? I would never want to see a Dr. Gerard in a radiology suite fixing my artery. So why would I want that for you? The most important thing on this slide is making the lifestyle changes. All right. Yes, stopping smoking. You got to see your doctor. Making the lifestyle changes is what prevents you from getting this heart disease that we're talking about, this arterial disease. When I talk about lifestyle changes, I mean better food choices, exercising, or walking. So I told him if he didn't make these changes, if he kept the same habits, he will 100% be back to see me for surgery. Because the problem with any artery disease, peripheral arterial disease, is progressive. It'll keep coming back. That means that even with any of the stents and surgeries, all these new stents we got now that, give your body this blood thinner so to help prevent it from coming back, it'll still come back. It may take a little bit longer. If you don't fix the smoking, stop smoking. If you don't fix the diabetes, the bad lifestyle habits, the plaque will build up, and all these nice, pretty stents that we place, these surgeries, it'll come back. And most of the time when it comes back, it's worse, y'all. So we want to prevent that from ever happening. That's why most vascular surgeons call what we do temporizing. That means that it only helps temporarily. Most people come back within 2 years with these new innovations, and maybe a little bit longer, but people come back. You got to fix the root problem. The root problem is comorbidities, which is getting your diabetes, hypertension, that under control, also making better lifestyle changes. All right. So I talked to my man, Mr. Barnes, afterwards. His wife was with him, luckily. So she got on him. He started an exercise program. Next to my clinic, there was like a little trail, a little circle, really. And it was just him and his wife walking out there 10 minutes, 3 times a week. It ain't fancy. Of course, this isn't him. But 3 months later, had him come back. He had quit smoking. He lost 5 pounds. and he was still walking without issues, y'all. And his ulcer was still healed. All right. And that's the whole point. Don't come back to see me, put me out of business, put people like me out of business. We got to take care of ourselves. That includes me. All right. Summary, if you have peripheral arterial disease, then you have systemic artery disease. It's a systemic problem. You must check your heart and your neck arteries. All right. That's number one. Number two, we inherit genes, yes, and genes may predispose us to disease, yes, but it's our habits that's hurting us, all right? It's not all genes. Don't let culture kill you. And I'm also talking about American culture, standard American diet. You know, we all know McDonald's and Burger King ain't right for us, but when what you don't realize is that those little meals, maybe 3 times a week over many years, ends up putting a lot of us in with heart issues, diabetes, blood pressure, all that. So don't let culture kill you. All right. Pills and procedures, for me, they're fun unless it's me under the table. So what I'm here to tell you is I'm changing my lifestyle habits because I don't want anybody in my family to ever need me. I don't want you to ever need me. Please change your lifestyle habits. Take the pills, do the procedures, do what you got to do, but we got to change our lifestyle habits so we can get healing. All right. And above everything I just said, I want you to remember this because this is the most important thing. Have faith in God above all else. But use the tools he's giving you, okay? And I'll tell you what the tools are. All right. I love this scripture. For I will restore health to you, and your wounds I will heal. Jeremiah 30:17. I'm sure y'all heard, beloved, I pray that in all things thou mayest prosper and be in health, even as thy soul prospers. Okay. So what do I mean by tools? The tools that God's giving you. All right. You're healthcare providers. All right. There's doctors, nurses, nurse practitioners, physician assistants, all of us. All right. We're just tools here to help you. All right. God is your source for healing, but God also gives you tools to help. All right. It's also taking your medications, doing the procedures, whatever you got to do. Just do what you got to do. Going to webinars like this, and also just seeking healing by changing our habits. All right. And this is something I used to tell a lot of people. I don't know if y'all know, vascular surgeons, we see over 70% of our patients are diabetics, unfortunately. And I'll say this all the time, no dessert or candy is worth an arm or a leg. I mean, I like this picture because, I mean, donuts already taste good. So why are we putting icing on it? It's ridiculous. That's our American diet, American culture. All right. Anyway, well, just thank you for letting me talk to y'all today. Appreciate y'all. God bless y'all.
Thank you so much, Dr. Gerard. That was so awesome. The chat box is blowing up. Everybody is taking your information to heart. Lifestyle habit changes is really, everybody's really zoning in on that. So thank you so much for talking about this. So important. You know, I've heard so many patients who have had, maybe they had a minor heart attack, fully recovered, minor stroke, fully recovered, and they think they're perfectly fine, but they're not. Like you said, this is a systemic disease. If you have one blockage in one artery, you have blockages in other areas as well, because all of our arteries are connected to each other from head to toe. So it is completely systemic. So we do have to make these lifestyle changes. And don't forget, like you said, it's important to take your medication, but medications can't fix it. It's still a progressive disease. Yes, you can keep your blood. Don't be disillusioned. Well, I'm on my blood pressure medication. My blood pressure is fine. My diabetes medication. So my blood sugar is fine. So I'm fine. No, it's still going to progress. The medications are just palliative for the moment, but it's not going to keep it from progressing. Only those lifestyle changes can. And there's scientific proof that shows that. There's plenty of studies that have showed people who make these healthy lifestyle changes, which we're going to get into in a minute, the important part, that it actually reverses the progression of the disease. Those blockages that he showed you on the screen, those will reduce and arteries can open up. And God is so amazing. He gives us so much grace. And if we get a reset, we get to do a redo. Like if you saw some of those little tiny branches around the one that was blocked that he fixed, once you change your lifestyle habits, you can develop an increase in what we call collateral circulation. So those smaller vessels will actually get stronger once you get things open back up again and you keep walking and keeping that healthy lifestyle. Those arteries start to open back up again. So it's amazing. You're not done. You can reverse some of the damage if you already have it. So that's so important. So I'm excited. Patrice, we're going to get into, now we kind of maybe scared you a little bit with some scary terminology and scary things that can happen, but we have ways to improve it, and we're going to get into those lifestyle habits, right, Patrice?
Yes. So I absolutely love the presentations that we've had so far because applied knowledge is power. It's not just having
Amen.
knowledge. It is applying the information. And sometimes when you're going to the doctor, you're not feeling your best anyway, right? We don't just go to the doctor just to go to the doctor. We go for those mandatory checkups. We go for the blood work because something about us is not at its best, right? And then sometimes we're going because we're not feeling our best. So I'm so grateful that the Healthy Lifestyle Ministry here at RNCC said, let's talk about the heart during Love Month, because this is the information that we need for not only ourselves to be educated and empowered and inspired and rejuvenated, right? For reasons why we need to make wiser choices, right? Think for ourselves
Amen.
and be the beacon of hope for the entire world. But not only that, we're getting information and tools on how we can be our own advocate. It is not your job to tell you when something's wrong. We know it, but we live in a world and we're constantly moving and going. So I'm so grateful that we are getting this knowledge. So I want to tell everybody, if you are on here tonight, it is time for you to like it. It's time for you to share. It is time for you still got time to tell somebody, get on here and get informed, because I'm pretty sure you are thinking about whether it's yourself, it's a mom, it's a dad, it's a family, it's a friend that needs this information. And you are here tonight because God needs you to help get this word out. And so we are going to keep it rocking and rolling, and we are going to get with someone that I absolutely love and adore. And you guys are in for a treat because we have the other half of the amazing Dr. Gerard Day. We have Dr. Tomika Day, who's going to be on here in just a moment. And Dr. Tamika received her Bachelor of Science degree from North Carolina Central University, her Doctor of Medicine degree from the Brody School of Medicine at Eastern Carolina University, and her certificate of nutritional health coaching from the Institution of Integrative Nutrition in New York. New York is in the house. Yes. Dr. Tamika currently provides medical services to the pediatric population of Wake County at Wake County Health Department, and is the founder and CEO of Flourish Health Coaching LLC, where she helps busy women like myself and many that are on here and their families to become healthier and balanced through faith, food, and lifestyle changes. Dr. Day is also the author of 21 Days to a Prosperous Mindset, a faith-based devotional sold on Amazon. So I myself, as well as our phenomenal leader, Rita, are going to get out the way, and we are presenting to you our amazing and phenomenal lady of the moment, Dr. Day.
Yay.
Thank you so much, Patrice, for that beautiful and amazing introduction. Welcome. I really appreciate it. It is such an honor to be on this platform with all of the amazing presenters that have spoken thus far. This is really about us improving the health of our community, our church, and beyond. So, as they have said, I just want to reiterate that heart disease is the number one cause of death in adults in the United States. So, this information is so important to get. If your heart is perfect, your numbers are amazing, I'm sure there is someone that you know that can benefit from this information that we are sharing this evening. So as we say, sharing is caring. So make sure you share this information. All right. So you have been educated and informed by our amazing presenters thus far about heart disease, the signs, the symptoms, and the disease process. So now let's redirect our minds. We want to talk about how can we prevent, reverse, and change the trajectory of heart disease in our lives. So the American Heart Association lists all these things that we can do to reduce the risk factors of heart disease. Now, we have our diet, right? So the American Heart Association has a specific diet. Of course, there are so many diets out there, from pescatarian to vegetarian to vegan to plant based to blood type diet. So many, but we are going to focus on the American Heart Association diet this evening. Physical activity, as Dr. Gerard talked about briefly, is super important. The American Heart Association recommends 150 minutes of moderate exercise every single week. Okay, so that means that when you're exercising, your heart rate should be going up and you should break a sweat. If you're not, that intensity is not there. Or 75 minutes of vigorous activity every week. So if your activity is causing you to get out of breath, have to pause, then that classifies as vigorous activity. Also, you want to have resistant or weight training at least 2 times a week. And if you haven't walked for exercise in over 5 years, I actually had a client that was like that. Don't start off on day one trying to run 10 miles. Okay. So you want to gradually increase your intensity because we don't want you to develop any injuries. Now, the next thing Dr. Gerard talked about, this is smoking. Smoking absolutely increases your risk of heart disease. So if you are smoking, stop. Okay, stop smoking. Here is a number that the American Heart Association shares about support and information how you can stop smoking. 1-800 quit now. Smoking in women, if you're smoking 20 cigarettes a day, increase the risk of a heart attack by sixfold. And in men, if you are smoking 20 cigarettes a day, by threefold. So we got to stop smoking if you are smoking. If you are young and you haven't smoked, don't smoke, don't start, right? Because this habit can lead to your death. So don't smoke, don't vape, don't use nicotine products. And parents, if you do smoke and while you're in that process to stop smoking, make sure, and you have kids, make sure you're wearing like a smoking shirt or a jacket. Out, smoke outside, don't smoke in your car. When you come back in, brush your teeth or rinse your mouth out. So, and take that jacket off. So when you pick that baby up, guess what? They're not inhaling secondhand smoke, which can be damaging for them. Okay. So the next category is your blood pressure. What is your blood pressure reading? There are so many different modalities out here now. I'm sure you've seen them in Walmart and CVS and all the pharmacies. Is take you probably like 30 seconds to get a reading of your blood pressure, absolutely free. But knowing what your blood pressure number is so that if it's elevated, you can get the help. You can seek your healthcare provider. So what is elevated? So the American Heart Association defines elevated as being the systolic or the top number greater than 130, or the diastolic being greater than 80. So if that's the bottom number. So if your blood pressure is elevated, this is a sign to you to say, hey, I need to reach out to my healthcare provider. I need to figure out what I need to do to get this number down to a normal range. All right, cholesterol. Cholesterol is important for our body. It is used for our bodies to make hormones and important cellular things. But know what your cholesterol level is. Okay, if your total cholesterol is greater than 200, that can be problematic. And Dr. Gerard showed us the diagram and the animation of how the vessels start to close. So it's really important to make sure your total cholesterol is less than 200. The bad cholesterol, the LDL, okay, you want to make sure that's less than 130. Your HDL, the good cholesterol, you want to make sure that is more than 40. And these numbers may vary depending on your specific disease or profile, or your specific health. But this is just in general. And your triglyceride level should be less than 200. So knowing what your cholesterol is really important. And we'll talk a little bit more about how what we eat affects our cholesterol. Obesity is a risk factor for heart disease. So it is important to maintain a healthy weight, not just so we can look good. Yes, that matters, but also it's important for your heart. It is important to have a normal weight, because it's going to help decrease your risk of developing the heart disease, the heart attacks, the strokes, right? So you want to monitor your calorie intake. You want to make sure you're eating well, exercising, moving, and things like that, so that you can maintain a healthy weight. Now, if you're losing weight, you want to lose weight in a healthy way. I always say if you're trying to lose 40 pounds, chances are you didn't gain 40 pounds in 2 days. So we shouldn't be trying to lose 40 pounds in 2 days. Yes, it's tempting. We want to get back to that right weight, but you want to lose about 1 to 2 pounds each week in a healthy manner. And lastly, your blood sugar. Your blood sugar level is so important, because when we eat in a way that raises our blood sugar, that keeps our blood sugar levels elevated, it can lead to type 2 diabetes. Type 2 diabetes can cause all these problems, heart disease, amputations, and all of these things. So that's why it is important to pay attention to what you're putting in your body to nourish your body. So knowing and maintaining a normal, healthy range for your blood sugar is really important. Also, you can have your healthcare provider check a hemoglobin A1C, right? So that gives you a average of what your blood sugar has been doing for the last 3 months. It can be normal. It could be in a pre-diabetic state, which means that you're not diabetic yet. So this is your opportunity to really get serious about working on these different ways to improve your health, or it can be elevated to a level that gives you that diagnosis of type 2 diabetes. So we're going to talk about the American Heart Association diet. Nutrition is very dear to me. It hasn't always been there. Even though I trained in medical school and trained in pediatric residency, I really didn't know a lot about nutrition. Unfortunately, our medical school curriculum, when I went through at the time, had very little information on nutrition. It's all about the medications, the pills, the surgeries, the disease process, the microbiology, all this information, but very little on what we actually put in our bodies to nourish our bodies. And so it wasn't until after I had been practicing for some years that my own health started to decline. And that's when I began to seek God's face and say, God, what do I need to do differently? Because I don't want to be on all these pills. I don't want all these, procedures and all. I don't want to go down that road. So what do I need to do differently? And God led me to learning more about nutrition. And that's when I enrolled in the IAN Nutritional Health Coaching Program. And in that program, I learned so much about food and the power of food, the nutrients in it, and why it matters. And just because it's in the grocery store doesn't mean it's healthy for you, right? So I learned all of that, began to apply it to my life, and thank God, my health improved. I also began to share it with family and friends, and they also saw results. So I knew that there was something very key to the nutrition, because we are what we eat. All right, so the American Heart Association diet. What is it? It is a wide variety of fruits and vegetables. So you see this illustration, all these different colors, right? This is how we should be eating. We should be eating like the rainbow. If your food mostly stays in one category, like, between a beige and an orange, No other variations. We need to add color to your diet. Whole grains versus refined grains, and we'll talk about that. Protein, your protein source should come from lean meats, legumes, nuts, fish, and seafood, low fat or non fat dairy. Liquid non tropical vegetable oils. Minimal added sugar intake is key. Foods that are prepared with little or no salt, limited to no alcohol intake, and adequate water intake daily, at least 64 ounces every day. All right, so when we talk about fresh or frozen fruits and vegetables, the benefit of those is that it doesn't have a lot of additives, salt, sugars, right? You have the natural sugar. But in addition to the natural sugar, you're going to get nutrients, you're going to get the fiber. But the can or jar fruits and vegetables have added sugars, added salts, added preservatives because it needs to stay on that shelf for about 12 months so we can buy it, right? So all that stuff has to be added to it to keep it preserved. If you think about a produce, take a banana, buy it out of the grocery store, that timer is ticking. That banana will not stay in a state that you can eat it for 12 months on your counter. Why? Because there are no added preservatives. There are no added things that's going to stop that whole process, right? So this is why it is important to have most of your fruits and vegetables come from fresh or frozen. So when you go into the grocery store to shop on the periphery of the grocery store mostly, right? And that's where the produce is. That's where the frozen foods are. So that is why it is important to begin to incorporate fresh and frozen foods into your diet. Okay, so whole grains. Now, whole grains contain the entire grain, the bran, the germ, the endosperm. And because of this, it is a good source of fiber, which is super important. Fiber helps to improve our cholesterol levels. So if your total cholesterol is greater than 200, you want to make sure you're getting fiber in your diet. Fiber can help you feel full so that you eat less calories. That's super important on that weight loss journey, right? But not only that, they're going to be nutrient rich. Vitamin B1, B2, B3, B9, the iron, the magnesium, the selenium is going to be in the whole grains. But when they're refined, they have been milled, ground into a flour or meal, and it has removed the bran and the germ, which means you're really only left with the carbohydrate component or the sugar part. So all the nutrients and the fibers have been stripped away from it. Why? So it can increase the shelf life. So it is good on the shelf for about 12 months, so we can buy it. But there are some that are enriched with nutrients. So, the manufacturer is taking a part of trying to put some of those nutrients back in it. But just know that they are not equal. So, white rice, bagels, white breads, and things like that have been refined. So, your good source is going to be like your brown rice, which is a whole grain. That's a good source. Your oats. So, eating oatmeal for breakfast is important, it's beneficial. Quinoa is amazing. Has so many sources, all the amino acids, and it's going to give you all of the fiber and nutrients as well. Okay, so your sources of protein should be coming from fish, shellfish, plant foods like beans, peas, lentils, and nuts are great sources of proteins. Your meat should be lean, skinless, and unprocessed. All right, healthy oils is absolutely important to have in our diet. So the American Heart Association recommends a diet of about 5 to 6% of calories from fat. So we do need this. Why? Because fats can help our body absorb some nutrients and protein and produce the important hormones that our bodies needs. But we want the source of the fat to be from healthy fats or healthy oils. So here are some examples: avocado, salmon, almonds, right? These are examples of healthy fats. So this chart shows the good, the bad, and the ugly. So when we talk about unsaturated fats, they can lower bad cholesterol, relieve inflammation, reduce your risk of heart disease, and provide like the essential fats your body needs. So like again, like we said, the salmons, the almonds, the olive oils, things like that is where we want to be getting our fat source from. When we start to get to saturated fats, they actually can increase the bad cholesterol. That's the LDL, which we don't want that to happen because that leads to the vascular issues. That increases the risk of heart disease. It lowers the good cholesterol, which is the HDL. So it's actually doing the reverse of what we want to happen. And as a result, it's going to increase your risk of heart disease and stroke. So red meat, palm oils are examples of saturated fats. And then the ugly is the trans fats. So those are like the oils that fast food restaurants use to fry, or frying oils, right? They've been changed so that it can withstand the extreme heat to fry the food, but they actually are very bad on our bodies. So here's just another example: the heart, good oils. So you see the almonds, the olives, the avocados, the salmons, the seeds, and then the bad fats, fast food, the nuggets, the fries, the burgers, and all of those things from the fast food restaurants or from just fast food in general. Okay, so also a part of the American Heart Association is minimal processed foods. And what are processed foods? Processed foods have been changed, packaged, or prepared in some way before we eat them. Unprocessed foods are foods that are eaten as it occurs in nature. So, like if you had a beautiful apple tree in your backyard, you walk out there and you grab an apple off that apple tree and you eat it, that is unprocessed. So, we want our diets to be full of unprocessed foods and have a minimal, small amount of processed foods in it. So when you think about, here's some this example, like the carrots, the beans, the cucumbers, right? As they are grown in nature. When we get to like canned, there's some processing that has occurred, right? And then when we get to like boxed cereals, crackers, and things like that, it's ultra processed. Like it really has been, stripped and changed in order to get that product. All right. Now, the American Heart Association diet also says limit foods and beverages with added sugars. So added sugars, we all know desserts, right? Your candies, your cakes, your pies, right? But sodas, we know that has sugar in it. The energy drinks to stay up, that has loads of sugar in it. Coffees, when you use creamers and different, you put the sugar in, the sweet teas, right? This is the added sugar that is going into the food. And you want to minimize that because that can lead to inflammation, that can lead to heart disease, diabetes, cancers, arthritis, like all of this stuff. That's why you really, really, really want to minimize how much added sugar you are having in your diet. Also, your breads, your bagels, your muffins, right? These are other places, the cereals, the crackers. What start reading these labels and you'll see carbohydrates, 45 grams per serving. That's a lot, one serving. So when you start seeing those numbers like that, that is a loads of added sugar being put into that food. And that can lead to the inflammation, that can lead to the heart disease. Limit your salty foods in your diet. So where do they come from, right? Your Chinese, your pizzas, your tacos, again, foods that are already been prepared that you don't control how much salt has been added to it when they prepared it. If you are preparing these foods, like if you cook tacos on your own, you can control to some degree the amount of salt that you are, putting in the meat or putting in, the filler for the taco. So you want to decrease the amount of salt in your diet, cook more at home. I know we're all busy, but you want to make it a goal to start preparing more foods at home so you can control how much salt and sugar goes in it. But also, your chips, your pretzels, and things like that. That this is not necessarily sugar; it's the salt. All right, and don't forget about your water. Our body is made up of mostly water. We should be drinking at least 64 ounces of water every single day. I'm talking about plain water, not water that is in the soda or water that's in the coffee or water that's in the tea. But we should be drinking at least 64 ounces of water every single day. Filters our kidneys, our body needs it, it energizes us, no calories. So you're on that weight loss journey, this is a beverage that will not add calories to your calorie count. Okay. So make sure you are getting enough water. Again, everybody's body is different. So if you're working out vigorously, you may need more than 64 ounces of water every day. If there are other conditions that you have, your doctor may say, oh, you need to limit that. But this is a general recommendation if you have a healthy heart, kidneys, where you can start off at. Okay, so I know that this diet change may seem like a lot. I know it felt like a lot to me. Again, going from the American diet to trying to eat healthy, whole foods, whole grains, fruits, vegetables, water, all this can be a lot. But I am here to tell you, as a testimony, that you can do this. I love the scripture. I can do all things through Christ who strengthens me, right? Philippians 4 and 13. So you can do this. This is so important to prevent heart disease death, to increase longevity, to improve your legacy, to teach the kids now how to eat. So when they are adults, they're not struggling to change or dealing with diseases that have occurred. So again, I shared my journey about 5 years ago. God put in my heart, eat better, change your health. I didn't know what that meant. And that led me down the journey of doing a nutritional health coaching program where I learned it, applied it. And I always say that this is not a sprint, but a marathon. So you're constantly doing it. Sometimes you fall off, but you got to get back up and get back on it and keep doing it and seek God's face. Lord, help me. I have a sugar tooth. I need your help. Help me to, make these changes, right? And God will lead you and guide you to, maybe it's reaching out to someone. Our healthy lifestyle ministry, we have a great team of people that are passionate about improving your health. So reaching out to someone, ask them, they'll share their journey and tips and things like that. Being aligned with others who are trying to apply these changes to their lives is super important. So we are so grateful for this church and this ministry, Dr. Chapman and First Lady Chapman. This is amazing to be able to just share these tips and talk about ways to improve our health, so that we can live long. And as the scripture says, I wish above all things that you will prosper and be in health, even as your soul prospers. But we know that what we do can either promote, what we eat can either promote health or disease. So you want to make sure you are eating in a way to promote health in your body. Again, I've coached multiple adults who have reversed severe heart disease risk factors, diabetes, cholesterol, inflammatory conditions by focusing on faith, food, and lifestyle changes. Now it is time to take action, right? This presentation has been amazing with all the presenters, but we now want you to take action, right? Now that you've learned or been reminded of heart disease and prevention, what are you going to do? And if you're perfect and you got it all together, who are you going to help? Because we know it is prevalent in our community and in our country. So, what are two things that you can do today to prevent heart disease in your life or in your family? Start today. Make a plan, write it down, get out the workout gear, throw the junk food away, right? Make a plan how you are going to start today. All right. We want to thank you for your time and attention and be well.
Thank
All
you so
right.
much, Dr. Tamika. That was
Mm.
awesome. I know people are loving it and lots of conversation in the chat box. You guys, we're winding down, but we are here to answer questions for you for a few more minutes. So if you have questions you want our panel to answer live, we can do that for you right now. Certainly, if you think about them later, you could always add them to the comments and we will follow up and answer those for you. So our team, we've got our social media team here too. Maxine is fielding questions for us to let us know so we can answer those for you. I want to thank all the presenters here tonight. You guys did an amazing job. I'm so blessed to have you on this team. The whole world is blessed to have you. Comments are really booming up there. And I just want to remind everybody too, we have a Facebook page, our Raleigh North Christian Center Healthy Lifestyles Ministry. We have a Facebook page where we're constantly posting content to help you on your health journey. So join us. It's just search in your Facebook groups. It's called RNCC Healthy Lifestyles Ministry. So please join us there. And if you're already a member, please invite your friends. Go down your whole Facebook list and invite everybody because the mission really is to spread the word around the world, help millions of people. We got about 900 something members as of today. But we want that to be many, many thousands and millions. So please share it with everybody. And Maxine, chime in at any time if you see any questions come up so we can report those. And I just wanted to say too, we talk so much about the importance of food as medicine. There is no greater medicine that you can take for your health than your food, eating healthy food. We got to go back in time and think about Hippocrates back in 400 BC, who's a Greek philosopher and physician and known as the father of medicine, who said, let food be thy medicine and medicine be thy food. And we need to go back to that. We're trying to chemically alter all these foods in the laboratory and come up with all this crazy processed sugar stuff. And like Dr. Tamika said, there's so much processed sugar. It's in everything. So I know it's hard because it hides in so many places. Really, like 70% of packaged foods in the grocery stores on the shelves have sugar in it. We're here to help you though, to minimize that because, and I do want to mention too, when she talked about the difference between the grains, the whole grains and the processed grains, even though the whole grains are healthier versions, it's still been so chemically altered and we've got so much toxic sprays on our grains. There's glyphosate, which is Roundup in our Quaker Oats oatmeal. So we have to limit that. And with 75% of the population being overweight and over 42%, almost 45% of the population being obese, we really have to be careful about the grain intake. So we don't want you eating, those whole grains with every single meal because too many people have diabetes and heart disease, and that higher blood sugar is going to contribute to that as well. So I'm going to be quiet now. If anybody wants to chime in and if there's any questions, let us know.
Yes, JP had asked a question earlier when Dr. Gerard was speaking. He said, how do you check your heart for PAD?
So can y'all hear me? Oh yeah.
Yes.
Right, so you check your heart for heart disease by going to your heart doctor. He'll probably start with the EKG, which is connecting these little electrodes to your chest. But a lot of times they also do an ultrasound. It's a type of ultrasound. It's not invasive. They're not putting anything inside your body. It's just putting this it's like a little probe on your chest and seeing how well your heart works. But that's heart disease. If you're also asking about issues with your legs, your leg arteries, then most family doctors know how to do this. But what I would do is call the family doctor office to make sure they know how to check what's called an ABI. Actually, you don't even need to ask that. You just call the family doctor and say, "Do y'all know how to check arteries in your legs for issues or disease?" And they'll tell you whether or not they do. Most of them do, but all they do is put a blood pressure on your ankle, blood pressure on your arm, check the pressures in both, and then they'll compare the numbers, and that'll help them figure out if you have leg artery disease or peripheral arterial disease.
But you're going to know it as well, like Dr. Gerard talked about. When you walk, you get that claudication. Like after a while,
Right.
when you walk, the muscles are contracting and they need oxygen, which is brought to the muscles by the blood flow. So if those arteries are blocked, that blood and oxygen can't get to the muscles. So that's when that calf pain starts, and that's what the claudication is. So if you have it and you're limited by your walking ability because you have to sit and wait and let the blood pool back down into your legs, then you have claudication. So yeah, any kind of calf pain, you should go see your provider.
Yes, he had asked that question previously, and then once Dr. Gerard was going through his presentation, then he was like, "Okay, I got the answer to that question about the calf pain." But it's great to just to reemphasize what do you do when you notice there's some pain. All right, there's another question from Rob Brewer. He said, "Is there a solution with all of the ads, all the bad food that's out there, and we see it every day?" All day, especially in the evening when we're watching television, unless we're watching ad-free television. That's the only way we can just bypass that. But anyone wants to take that away, is there a solution? That's a big question.
It's temptation, right? I mean, and that's why I say it's so important when you are on this journey to surround yourself with a community that is trying to do the same thing that you're doing, because it is hard. I talk to people all the time, and that's like, what makes this so hard is just, this is the American lifestyle, right? It's everywhere. When you're working long hours and you need a quick bite to eat, you look and it's like, oh, fast food here, fast food there. I only got 10 minutes for lunch, right? So that is just part of our society, which makes it harder, which there's no wonder that the prevalence is so high in our country with heart disease. And it's not like that everywhere around the world, because the way they live and eat is different. So you just got to connect yourself with, the right community, take steps to, meal prep. And just remember why you are doing this. You are trying to prevent strokes, heart attacks, amputations, diabetes, all this stuff that is terrible.
Yes, and I would say that we have to be intentional. It has to be a mindset. We have to renew our mind every day. And when we say renew our mind, you really have to get up intention, because it's like she said, meal prep, and you really have to, for me, have to renew my mind to do that sometimes, because it can be a task.
Absolutely.
But it's well worth it. Sometimes I don't want to exercise. Like today, I put a struggle post because it was hard. But as the scriptures we said, we can do all things through Christ. And we really have to speak that word like out loud, journal, write your emotions, find out if you're an emotional eater, find out what kind of eater you are, find out, do you eat in conscious? Like I tell people, I'm a conscious eater. I read labels. I kind of don't eat to live. I live to, I eat to live. I don't live to eat. And we have to just change the way we think of it. And I definitely can testify to that, because I eat totally different than my family. I haven't brought them all the way over yet. But it's a challenge.
I'll just add to that with the food ads. One way you can just really kind of, I guess, trick yourself to not even pay them any attention. If you look up on YouTube how food is staged for those ads, that food is not even edible. It's glue and marbles and all kinds of gross things. So when I see those ads, that's what I think about.
Awesome. I saw another question, Max. Did you see that one? So Nikki wants to know, what do we think about the statin drugs? So,
well,
anybody?
If you're prescribed statins, talk to your doctor about it, because all medications have side effects. And if they're, well, you know, if your healthcare providers want you to take that, then I'm sure they have a reason. But you got to think of all medications as a temporary thing. I know with statins, especially if you're trying to walk or run, that can really mess up. You know, it can give you some muscle aches that prevents you from running, and people gain weight, and then you know all of that. So, but first, you know, I'm always about talking to your healthcare provider about it, and they should be the type of people that you can ask questions. Because if they're not, you need to get another healthcare provider. But what I think about statins is it's a temporary thing. It's something I definitely would not want to stay on. But it's something just temporary until you learn what types of foods that you can eat that will lower your cholesterol, and so that you don't have to depend on a statin or any drug to keep your cholesterol low.
And exercises also helps reduce the cholesterol.
Yeah, and you know the statin. You got to remember that our healthcare system is driven by the pharmaceutical industry, so
Yes.
they want everybody to be on a statin for life. So because that's how they make money. So there are certain protocols. If you have heart disease or if you have diabetes, you're automatically going to get put on a statin. So yes, if you've had a heart attack and you need to keep your risk factor down, you're absolutely going to be recommended that you take a statin. But like you said, there are side effects that come along with it. People can have very severe muscle cramps. You can have liver complications. They also can cause depletion of really important minerals like zinc and copper and selenium, CoQ10, which is very important for your mitochondrial function, for your cellular health. So they're not without side effects. Any medication, every single prescription drug is really a toxin to the body. I'm not saying go stop your medications, but I'm saying that's not the ideal. We don't
Right.
want to be on lists of, and I see every day patients with 20 medications a day for all kinds of different things, and another medicine to help the side effect of the other medication, and so on. It's, we call it polypharmacy. It just continues to go on and on and on. So we don't want to have to rely on those things. Like you said, if you need it and some people have familial, very high cholesterol levels that put them at very high risk for heart disease. And those are the kind of people who need it. But ideally, we want to be able to stay off of them as much as possible.
And when you go to your doctor, if you have to take medications, just be mindful to know what they are, know when your doses are, know when the last time you took them. So it'll make it so much easier, especially for Black Americans, because there are so many health disparities. And when you go in there informed, you're going to have better outcomes. So just make sure if you go to the doctor, or if you're at a hospital, you know your meds, and ask them when they're prescribing to you, be mindful of the side effects, and ask them to go over them with you, because sometimes I've seen it where people got switched from different cholesterol agents. So just be mindful. If you have to take them, know what they are, know what the side effects are, and be well informed and prepared when you go there and ask questions.
Yeah. And we've been tricked into believing that cholesterol is the big enemy, right? She talked about the saturated fat and all the different types of fats. But really the biggest problem is the sugar. So that, you know, came around in the 1960s. You could talk to Janae Williams. She's super passionate about the book, The Big Fat Surprise, where it really kind of unveils the history of where cholesterol began to be vilified. Because we need cholesterol, like she said. It's very important for so many functions of the body. For all of our entire hormone cascade of the body originates from our cholesterol. So we need it. And the fats coat our cells and protect the cells. So we really want to focus more on reducing the sugar than, you know, the cholesterol. But of course, the processed fats, like she talked about, are the important ones to stay away from. But sugar is much more of the villain than cholesterol.
And to just piggyback on that, sugar is stored in your body and it turns into fat if it's not burned up. And so it's stored in your cells as glycogen, which turns into glucogen, and then it makes sugar and it's stored as fat. And what that does is stretches your arteries and causes inflammation.
Yeah, and the other thing about the cholesterol numbers too, which they don't really talk about, again, because it's so pharmaceutical driven, those statin drugs are really good at lowering the LDL cholesterol, but those are not the biggest risk for developing cardiac disease. It's really the triglyceride to HDL ratio. So if you take your triglycerides and divide it by the HDL, you want that number to be less than 2. And that if it's over 2, that increases your cardiovascular disease risk. So look at those numbers, and it's the breakdown too. And also, if you're not sure, if your doctor's really or provider's really pushing you towards taking the statin, and you're not really convinced that you need it, you could request getting what we call a coronary calcium artery scan. So it's basically a CAT scan that looks at the arteries of your heart. So you're not just going by what the blood test shows. You're actually looking at pictures of the vessels of your heart that shows if you have those plaques that Dr. Gerard shared. It maybe cost a couple $100 out of pocket to look at, but it's a worthwhile investment in your health to see whether or not it's something that you really need to take or not.
All right. Great information. Just to that one question, we have folks just chiming in and giving great information, but thank you all for providing that information. All right, Diane had a question related to her friend, some symptoms that that she had. She wants to know if broken varicose veins is connected to the heart with anything that has to do with any heart issues.
Yeah, that's rare. I get that question a lot. There is so rarely, if you have severe congestive heart failure, that backs up pressure in your venous system, and that can lead to some venous issues. But that's rare. Most of the time, varicose veins is a totally separate issue, and it has nothing to do with the heart. So most of the time, it has nothing to do with the heart. Also, tell your friend to start wearing compression stockings. I don't
Yes.
know if they've been told that already, but what tends to happen with varicose veins is it'll progress. It takes a while, but 5, 10, 15 years from now, the varicose veins will grow in size. They'll get bigger. They get more painful. It will lead to other stuff. So she should start, or he or she, your friend, should start wearing compression stockings, at least 20 millimeters of mercury. Well, the low to medium. Start with that. They should work themselves up to medium compression. And she'll know what I mean. He or she will know what I mean when they go to buy them. There are different amounts of pressure. I used to start people off at the medium and the high, and they wouldn't wear it because it's too painful. I wouldn't wear it. But if you start with the low pressure ones, you get used to it, and then you can work your way up to medium pressure.
Okay.
Yeah, and elevate your legs whenever you can too. When you're off your feet, put them up.
Yeah, that's right.
And when you go on the airplane, put your compression stockings.
Yeah, get up and walk around. Same thing with long car drives too. Yeah. Do we have any other questions, Max? I think we're winding down, and
Yep,
we
there
can
are
certainly
no
continue the conversation later.
Yeah, there are no other questions in the chat
Awesome. Well, we
space.
want to just thank all you guys for being here, attending. I thank all my presenters and my co-mods and social media team. I'm just so grateful for all of you. Please remember to share this broadcast with everybody so we can bless millions of people around the world, and join our Facebook group, RNCC Healthy Lifestyles Ministry, where you can be blessed with health content on a regular basis, not just these occasional webinars. And don't forget to share this with as many people as you can. Thank you guys so much, and have a great night.
All right.
Good
Thanks,
night.
all. Y'all take care.